Okay friends, so today we will going to discuss about some antifungal inhibitors. So we have completed our lecture series on antibacterial agents. Now it is time for discussing about antifungal inhibitors. So there are two antifungal drugs with their mode of action is in our syllabus. So one is Amphotericin B, that is our today's topic, and another one is chrysophalpin, which I will upload in the next video. Okay, so let's start about discussing Amphotericin B. Although I have discussed with you about Amphotericin B when I have conducted a video lecture on fungal disease. Remember that we have treated invasive candidiasis with the help of Amphotericin B. Okay, so today we will going to discuss about how Amphotericin B causes the fungal destruction and protect us. Okay, so the first thing is it is a cell membrane inhibitor. Okay, so let's see how. Okay, so although it, first of all we need to know about how Amphotericin B. Before going to discuss about the mode of action of Amphotericin B, it is necessary to discuss about how fungal cell membrane is synthesized. Okay, so it will help us to understand how Amphotericin B causes the damage. Okay, so I want to mention you that the fungal cell membrane is composed of a compound called ergosterol. Okay, this is specifically for fungal cell membrane. You do not get ergosterol or do not get ergosterol in our human cell membranes, right? So now let's discuss about the pathway that is going on inside the cell of fungus, which ultimately gives us ergosterol. So first it all started with squalene. Okay, from squalene, via squalene epoxidase we get squalene epoxide. Okay, from squalene epoxide we get lanosterol. Okay, so from lanosterol via 14 alpha demethylase we are getting ergosterol. Okay, and ergosterol then in turn produces the fungal cell membrane. Okay, so you can remember it and you may mention it during your exam, so for getting a better marks. So now I think I do not have to mention what is the function of cell membrane. So it is responsible for selective movement of ions and molecules across the membrane, right? So it provides selective permeability, right? So now this Amphotericin B will cause or create a pore in that fungal cell membrane. Okay, that is the idea of Amphotericin B. So we have to discuss how. Okay, so Amphotericin B will interact hydrophobically with ergosterol. Okay, in fungal cell membrane. So I have already discussed that fungal cell membrane is composed of ergosterol. That means what? That means by interacting hydrophobically with ergosterol, Amphotericin B affects the cell membrane. Okay, and creates a pore. So that means another important thing that is necessary to mention here, that the cell membrane is nothing but phospholipid bilayers. Okay, so phospholipid bilayer consists of two parts. If you zoom this picture, then this round shaped structures are called head, which is generally hydrophobic, and these inner parts are called tail, which is generally hydrophilic. Okay, so these phospholipid bilayer are made up of ergosterol, right? And this is the cell membrane of the fungus. So the Amphotericin B will interact with the ergosterols hydrophobically. Okay, and creates a pore in the cell membrane. Okay, so now let's consider that this portion is the extracellular environment. Okay, and this one is intracellular environment. So in the intracellular part there should be various kind of ions present of various size, right? So now when we add Amphotericin B will hydrophobically interact with ergosterol and creates a pore in the cell membrane, isn't it? Right? So as a result, all the ions which is in intracellular part will be released into the extracellular environment. Okay, and as a result those ions get lost, right? And as a result it facilitates the cell death. Okay, so as fungal cells are died, that means after that the infection will also be removed from our body, right? So that is the idea of the amphotericin B. So again, so amphotericin B is what? Amphotericin B is a cell membrane inhibitor, right? It interacts hydrophobically with the ergosterol, which is responsible for the formation of the cell membrane. Okay, and cell membrane provides selective permeability, right? Various kind of ions, let's say potassium ion and other kind of molecules, are releasing from the cell membrane. Okay, selective permeability is the main job of the cell membrane. But if we add this amphotericin B will bind with the ergosterol hydrophobically and creates a pore. As a result, the ions are no longer transporting selectively. Okay, as a result a lot of ion will be removed from the intracellular part of the cell, which causes the death of the cell. Okay, and which facilitates the improvement in the recovery of a patient who is infected with any kind of fungal infection. Okay, for example, let's say invasive candidiasis, where we have used amphotericin B. So this is the mechanism of action of amphotericin B. So I hope this video will be helpful to you to understand the basic concept of the amphotericin B. So we will again discuss with another video lecture where we will going to discuss about grisofulvin. Okay, so till then, bye bye.